Hello friends. Once again, there's news from China about a virus spreading. Recently, videos on social media have gone viral showing many patients in Chinese hospitals. These patients have flu-like symptoms, and some hospitals are overcrowded. People are worried if this could be like COVID-19 all over again. COVID-19 started 5 years ago in a market in Wuhan, China, and spread worldwide. Now, as per the Global Times, a Chinese government news website, the virus is spreading in cities like Beijing, Chongqing, and Guangdong. This virus is called HMPV, the human metapneumovirus. The first question people ask is, how dangerous is this virus? But this virus isn't new. It was discovered 24 years ago, in 2001. COVID-19 began in 2019, and likely came from bats. HMPV, however, is believed to have started in birds 200 to 400 years ago. Over time, the virus changed and now only affects humans, not birds. HMPV was first detected in humans in 2001 in the Netherlands. It's not that the virus suddenly appeared in 2025. It has been active every year, but people mistake it for a common cold. Most people don't realize they have HMPV because the symptoms go away on their own. This is why it's called the anonymous virus. HMPV is a respiratory virus, so its symptoms are like the common cold or flu. These include fever, cough, blocked nose, and trouble breathing. The virus takes 3-6 days to show symptoms after you get infected. How severe the illness gets depends on the infection and your health. Children and elderly people may develop serious issues like pneumonia. Professor Paul Hunter from the UK says most kids under 5 have had HMPV at least once and get reinfected later in life. HMPV spreads like the common cold, through droplets from coughing or sneezing, or touching surfaces touched by infected people. To stay safe, keep a distance from infected people and cover your nose and mouths while coughing or sneezing, preferably with your elbow, and wear a mask in public places if you go outside while infected. Wash your hands regularly, because your hand often touches your face or nose, and you touch various surfaces in public places. It helps prevent infections. Most healthy people don't need extra treatment. Drink water, rest, and the virus will go away in 5 to 10 days. But for those with weak immune systems or serious health problems, HMPV can cause complications and would need to be admitted to the hospital. Now, how deadly is this virus? And should you worry? There's no vaccine for HMPV, even though it was discovered 24 years ago. Efforts to make a vaccine faced safety issues and didn't succeed. Some vaccines were tried on animals, but in many cases where animals were given the vaccines, their lung inflammation worsened. It did not reach the human trials. 1. Because of the safety concerns, and 2. Because there could hardly be any sort of long-term immunity, like the common cold, which has no vaccine because it's not caused by a single virus. It is caused by 200 different viruses. HMPV keeps mutating, so immunity doesn't last long. But don't worry, experts say mild illnesses can help keep your immune system strong and responsive. China's National Disease Control and Prevention Administration has recently acknowledged that respiratory illnesses like HMPV are rising. But the Chinese Foreign Ministry says that the scale of the spread of respiratory illnesses is lower than that of last year. But experts say this is normal during winter, when China had strict COVID-19 lockdowns. People weren't exposed to many viruses for years. This weakened their immunity. After the lockdowns, infections surged because people's immune systems weren't ready. The winter of 2023 was the first in China after the lockdown was properly lifted. This is why during the last winter, there was a massive surge in the number of flu cases in China. Even though cases have risen, it's less severe than last year. The WHO says there's no global emergency, and HMPV isn't mutating dangerously. The Guardian claims that experts say HMPV isn't as serious as COVID-19. It has been around for decades, and most people already have some immunity. By age 5, most kids are immune, and reinfections are mild. In rare cases, it gets serious for infants, people with lung problems, who have chronic obstructive pulmonary disease, COPD, or weak immune systems. Other people may suffer coughing bouts for a long time, but there is no cause to worry. So how deadly is this? According to a study published in the medical journal The Lancet, in 2018, about 16,100 people died from HPMFE, of which 65% were children under 6 months, according to this paper, because of HPMFE. But WHO spokesperson Margaret Harris says that the risk of death in HPMFE cases is very, very low. Children under the age of 1 are at the highest risk. HPMFE can block those, and their immunity is weak too. For these infants, it's difficult to fight this virus. The actual number of deaths caused by HPMFE is difficult to calculate, because the data on many respiratory diseases overlaps with this. If you compare it with COVID, once someone is infected with COVID, there's a 0.28% chance of them dying, known as the crude mortality rate. If 100,000 people get infected with COVID, then 289 people would die. Obviously, this is the global average. The exact rate depends on the region you live in, your health, access to hospitals, and the hospital facilities. If this rate is compared to flu or influenza, then if 100,000 people get influenza, only 1.8 of them would die, a 0.0018% mortality rate. If we combine the data of influenza and pneumonia, on average, 14.1 infected people of 100,000 die, a 0.01% mortality rate. But we don't know the exact rate for HPMFE. But looking at the numbers, you can estimate that the mortality rate of HPMFE would be much closer to that of influenza and pneumonia, and farther from COVID's. Compared to COVID-19, HMPV's death rate is very low, and closer to that of the flu or pneumonia. It is true that it is difficult to get reliable information from China because of the high censorship. There's no sign of lockdowns, and China reports fewer cases this year than last. So, don't panic. Follow good hygiene practices and focus on bigger issues.